Hugh, let's dive into health then, which is the number one thing on the Ipsos tracker. Well, first of all, I'm guessing you're probably a bit disappointed how little health is featured in the day-to-day election campaign. It's been there, but we've not had like a few days of sustained conversation about a big health story, have we?
Yeah, I mean, my recollection, Adam, is there's only been one occasion which has been captured on camera on a microphone of heckling of a politician, Rishi Sunak in this case, by somebody who's really concerned about health. He was heckled out on the stump in Wiltshire, I think, about somebody saying there aren't jobs for GPs. So it hasn't been a moment quite like that. But it's always been there or thereabouts, and the parties have churned out numerous press releases, which haven't always got covered, about their plans for more GPs, their plans for modernising hospitals and more equipment and so on. But they haven't necessarily dominated. But I think the key question underlying all of this is, have they really come clean about being realistic about what sort of money and funding is needed for the next Parliament for the NHS, given all the pressures I'm sure we can talk about? And the answer is probably not, in the view of most think tanks. This is the one thing they don't want to talk about, what it is likely that will be needed and what the implications might be for tax.
I mean, the thing about the NHS, I always think it's like a giant octopus with lots of tentacles, and it's very hard to keep track of it all in one go. But if you had to sort of just join all the dots about the problems, like where would you start, and where would the lines go between the dots?
Well, I think in terms of England, and health in England is really, to a large extent, what it's all about, because it's a devolved issue. So the Westminster election has focused a lot on health in England, the NHS there. I think it starts from that 7.5 million figure, which is the total waiting list, which has gone up massively since before the pandemic, when it was 4 or 4.5 million, and the consequences of that. So it's all the people affected by that. It's not actually 7.5 million people. It's more like 6.5, because some might be waiting for more than one appointment or more than one treatment. But it's all the people stuck on that waiting list for long periods. There's more than 3 million, I think, waiting more than 18 weeks, which was the target. What's happening to their health? Is it getting worse? And the answer is, in some cases, it is. So that affects GPs and appointments. I've spoken to GPs who say they're having to try and help people on these waiting lists who can't get through to the hospital to find out when their appointment is. They want some help from the GP, who can't offer very much, and that adds to GPs' workloads. But also, I've heard from a radiographer who says they're having to scan people a second time because the first scan was such a long time before that it's ceased to be useful. So the whole thing adds up to this pressure. And then, of course, there's endless questions about community and social care as well. But I think it all starts from that waiting list.
And I won't get you to go through like an exhaustive list of all the party's policies, because I always think that makes quite boring listening, even though it's very, very important. And I should say the BBC's got an amazing tool on the website where you can tick what area you want to hear about and then tick which party's positions you want to read about, and then it generates a little sort of screen for you. But what are the sort of different kind of philosophical and political approaches to dealing with all these challenges that we've heard presented over the last few weeks?
Well, if you look at the Conservatives, Labour and the Liberal Democrats, I think there isn't a lot between them in terms of ideology. The Liberal Democrats have sketched out a bit more in terms of raising money and what they'd spend it on. But the sort of retail offerings are quite similar. More GPs, thousands more GPs. The Conservatives talking about their 40 hospitals plan. Labour are talking about 40,000 more appointments per week, which sounds a lot, but the current figure is 2 million, so it adds a bit, but not a huge amount. Lib Dems wanting to recruit 8,000 more GPs. So it's all to try and reach a voting audience with, this is what we would try to do to make things better, because waiting for a GP appointment is a massive challenge for many people. But how do they deliver? What money will really be needed? I mean, all those are unanswered questions.
And I think that's the common theme amongst all these positions, whether it's what you were just saying there, or the SNP saying that health spending in England should go up by a lot, so that the knock-on effect is it goes up by a fair bit in Scotland. These are all sort of things that are easily said and hard to do in a big, complex, quite money-thirsty system.
Yeah, I mean, we as journalists will always ask each party, how are you going to pay for this? And they come up with specific plans about taxation. But going back to the think tanks, they're saying this is sort of scratching the surface. If you really want to get to grips with that 7.5 million waiting list and bring it right back down. And remember, the main parties are saying they'd hit the targets, which haven't been hit for several years, actually bringing those waiting lists down to targets. And what about all the demographic pressures, an ageing population, a growing population, how you'd cope with the money that's needed for that, where it would come from? And then, of course, the prevention agenda, which is hardly talked about. How do people get healthier so they don't need to go to hospital?